In today's Kaizen Dental Success Stories podcast, we have with us Dr. Manish Chitnis to talk about the importance of systems in a dental clinic. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Dr. Manish Chitnis obtained his dental degree in India and has enjoyed a successful career in dentistry for the past 25 years. After gaining experience in India, he shifted to UK where he worked in various small as well as large corporate dental clinics. He then went on to set up his own practice and is currently the owner of Dental Concepts. He now owns 5 high-end dental practices, 4 in the UK and 1 in India. These practices are advanced state of the art treatment centers with all the latest technology available. Besides growing his dental practice, Dr. Manish is passionate about sharing his knowledge and resources. In 2015, he co founded Dental Business Masters, a business management program to help dentists understand dental business and take their practice to the next level. There have been 7 batches of DBM graduates in the year long program, with 6 in India and 1 in the UK. DBM 7.0 is soon to be launched. Hello, sir. Thank you for your time to come and share your information about how to run systems in clinic.
Thank you. Sadish, thank you first of all for reaching out and congratulations on the great work you're doing. I've looked at your YouTube channel briefly and I'm going to get into the depth of this videos, which are very helpful for young entrepreneurs as well as people who are just finishing their BDS. So well done and thank you.
Thank you, sir. So, one thing, I've attended your courses and I've seen you always speak about the importance of systems. Okay. So, my point is, why do you think that systems form the backbone of the clinic?
Sure. It has been said before, a memory can fail, but system won't. So, in effect, human brains work in a certain pattern, and I always say to myself, my team, suppliers, anybody who's working with me, that if there is no system, we are fully dependent on a brain of a certain person or a group of people. And what if that person is missing? If it's a bad day, something has gone wrong, we forget, and then things don't work basically. So if there is a system and 1 plus 1 is equal to 2 and it's been followed, then things will work like clockwise. And success is all about consistency. As we all know, success doesn't happen overnight, and success happens with practice, and practice makes us perfect. So all the time, if there are systems and there is consistency, the team knows exactly what to do, you will see positive results. That's why I think systems are very, very important.
Okay, but is there one system or multiple systems which need to be applied to a clinic?
So everything you do, I'm going to give you your example. This video, which you are going to format, you have created a system. We went straight into questions, but obviously the audience which is watching has watched something at the start where you have introduced me, okay? And that is something which you are going to film separately. Now that's what you are going to join into this video. You're going to do an end. So there is a system of phase 1, phase 2, phase 3. And if you break the pattern, if somebody else, you say, oh, I can't make it today to interview Manish, can you go and do it? And he does something where you haven't explained the system of recording this video. By the end of it, when you look at something, I say, oh, fish, you did a mess, man. You didn't do it correctly because I wanted it this way, this way, this way. Oh, you should have told me. If it's a written down paper to say that system 1, system 2, system 3, this recording is going to be correct. Yeah, so that's a system, and there will be various systems. So whatever we are doing in day-to-day life, so getting up in the morning is a system. Getting up in the morning and the hand goes first towards the mobile phone. That's become a system, correct? Most of us do that, which is wrong, but we pick up the mobile phone. Then we go brush, shower, whatever we do. Then we wear our clothes, then we go out. So it's a system. And if you disturb the system, then things go wrong. So I'm going to say system is everyday life, personal, professional life.
So, what all systems are required in a general dental practice?
I'm going to give a little quick overview, and that is the pillar of what I teach as well on the Dental Business Masters program. So, systems are revolving around 4 or 5 different sectors. Um, first and foremost, which I call it as the health of the business, is financial systems. So as always we say, if the cash flow is correct, money coming in, money going out is correct, then everything else can become healthy, which means you have peace of mind, the team is being supported, materials are being bought, laboratories are the nice correct laboratories, patient experience is good. So financial systems is probably one of them. Alongside, I would say practice management systems, which means opening the practice protocol right up to closing the practice protocol. So there could be 300 plus systems in the kit which I teach, and it is systematic to say who comes first, what do they do. So practice management systems. Then I call it as a patient examination or speaking systems, which means consultation systems, where a patient walks in and he's coming into for a clinical examination. Dr. Satish does something, Dr. Anaga does something, Dr. Manish does something. As a consultation, the patient experience is going to be different in different sections. But you come into dental concepts and all the 10 dentists will do the checkup exactly the way we need to do in dental concepts. And there are 35 things to do. And if they know all the 35 things, then they're going to give the same patient experience every time to that patient or all the patients, basically. So I'm going to say consultation systems, speaking systems, communication systems. Then there is patient experience, which means from that first phone call, when the patient calls you or sends you an email or walks into the practice, what happens after that? So there is a system. Ethical marketing systems, patient relationship building systems, referral systems, testimonial systems. So part of growing your business is patient acquisition, patient retention, and patient growth. So there has to be a 5-step system in that as well. So ethical communication, which leads to serving and selling, ethical marketing, which is patient relationship building, finance systems, practice management systems, and patient experience system. The patient journey from point one to A to Z, and then back again at A and A to Z. So they keep coming back to the practice, and if the experience is the same or gets better, they will remember you, they will recommend you. So I think those are few nutshell zones of systems, and obviously the biggest one is compliance, which obviously comes into practice management, but it's all about health and safety, infection control, everything where we all are safe. Dentist, team members, patients, community, all our premises. Compliance is another big important part.
Understood. So you've mentioned a lot of systems. Is
Yeah.
there any one specific system which you think moves the needle the most, or is the most important system in a clinic out of all these?
Yeah, uh, this is a question where picking one system is going to be difficult, but accountability systems are the key. Holding myself accountable as the owner and leader, holding my team members accountable to the work they do, holding my suppliers accountable to deliver things back to me, holding the community accountable or the patients accountable to do what they need to do. I think if I have accountability systems in place, the business will run on track. And going to give you one example. 9 o'clock is my first patient. I need to show up. Yeah, if I don't show up, there is a problem. Yeah, so I need to hold myself accountable to come at 9 o'clock. That's number one. A patient also is accountable to come at 9 o'clock. Yeah, if I don't go, I'm not going to be paid, which means I'm not going to earn money for my livelihood. So that itself as a human need is keeping me accountable to go at 9 o'clock and get my work done. But how does a patient actually? He's not going to be paid for coming in, correct? So we have a system called as a pre-booking system. So we charge 500 rupees in India to say to pre-book your appointment to get it confirmed. We will accept 500 rupees from you put it onto the system, that goes into credit, and if you arrive, obviously that money is used towards your treatment. But if you do not give us any intimation, if you do not turn up for your appointment, we reserve the right to keep the money to cover our admin cost. 90% practices in India, I would say, worry, are scared, and will not do this system. 10% will do, and those 10% are happy because their show rate is high. And the one word is accountability. So if you have accountability systems, I think that's the most important system to run a business and keep on track.
Understood. But you train a lot of clinics which are already running. So there are
Yes.
no such systems. You have to put these systems suddenly. So
Yeah.
when, as a clinic owner, you understand the importance of systems. But a
Yeah.
lot of times there is a pushback from your staff, maybe assistants, associate dentists, and everything, who do not understand these systems. They think the clinic was already running fine. Why do we need these systems? So, how do you get this buy in when you're implementing newer systems to a running practice? Before you listen to the answer of this question, if you're liking the video, please do not forget to hit the like button below. And I'm sure if you want to take your career in dentistry to the next level, you're already subscribed to the channel.
The first point here is about mindset. And as a owner or as a person who is going through educational system needs to believe in that proposition. So if I give a proposition to say, Satish, get this pre-booking system in place, you first of all need to believe that this is necessary. If you as a leader don't believe it, the staff is not going to buy into it. So that's number one. Number two is there is an implementation process. So as I've matured in this training program and I'm sharing my experiences, I've done this and had the backlash and the feedback from the staff, etc. And the funniest thing what people say is they come on the program, when they go back, their staff is like worried because ma'am has gone for a week and now she's coming back with all this stuff from Manish and we are going to be hammered. So I said to people, just calm down. You absorbed. First of all, believe that this is helpful. What is it going to change for you? And is it positive? Yes, then you need this. Sit down, induct your staff. That's word number one. Induct your staff on what is the system? Why do you want to do this? What is the outcome of this? How is it going to benefit all of us, including the patients? Once it's sort of imbibed into them, or it's sinking in into them that, okay, I understand what it is, then don't implement the system on all 5 days. Do a trial day. On that trial day, you're just going to test the system. You will have feedback, but you have to do a certain number of patients for that system. Say pre-booking fee, 20 patients that day. Everybody is told about pre-booking fee. Now there is a feedback to say, doctor has changed, he's after money, blah, blah, blah. He never did that. Fair enough. What is the plan B if that happens? Is that documented? Is it ready? Yes, that's a system. If this happens, we're going to do this. Yeah. So I teach on pre-booking fee. Obviously, today is not a topic of pre-booking fee, but how to implement pre-booking fee, how to induct the staff, how to improve the telephone skills. What if scenario number one? What if scenario number two? What if scenario number three? What are the backups for these? Because only 3 or 4 scenarios which are going to happen once you put the system in place. And then what is the accountability to move from a trial day to 2 days a week, 3 days a week, 4 days a week, 5 days a week, and then it's sinking in. And for 5 days a week, if you're doing it, it doesn't become a system, it becomes a habit. And once it's a habit, you don't need to write it down anywhere, it's there. And if we get a chance, 5 minutes in the show, I will like to share screen and show something which is called as Dent-Track. So it's my new baby, and staying on track is all about accountability. And I have come up with last 6 months of hard work a system called as Dent-Track, which can be on your phone, on your laptop, where you go in, and when you go into work as a dental nurse, you have your 50 jobs already on your portal, which means as soon as you finish those 50 jobs, you just go done, 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 done. So when you leave outside your door, you have already told your owner that you gave me 50 jobs to do as a dental nurse. I have done it. And this system has generated with the gap, exactly like people said, Manish, you teach beautifully, I get it, but when I go to implement it, I can't hold people accountable. What do I do? and that has been a big gap. So we have come with a solution. If I get a chance later, I'll just share screen to show
Sure,
you.
sir. Sure. So basically, you're telling when there is a pushback, first directly do not apply those things, get the buy-in, explain them, then do a trial phase, slowly increase the days, and then make it into a system and a habit.
Absolutely. It has to be a
Understood.
slow ingestion. And once the importance is realized as a leader, you have to be on track to push it, to make sure it's implemented, and everybody is accountable to do that, because it's not their passion, it's not their priority. It is what you want to get in as passion and priority. So you need to lead the show.
Understood, sir. So now imagine a new dentist is putting all these systems. Okay. What is the common mistake you have seen in application of so many systems?
I think I wouldn't use the word mistake. I would say that the feedback a dentist gets is whenever new education happens, they are quite excited about it. The excitement and the energy lasts for 3 days. And after the fourth day, it starts going down. So it's all about comfort zone and uncomfortable zone. So when you start changing things, it goes into a uncomfortable zone for self as well as the team as well as the patients. And I don't think it's a mistake. It's a human reaction. When you start getting uncomfortable, you want to go back to comfort zone. And the feedback to new dentist or whoever, experienced dentist wanting to do this, is when they start introducing a change, remember that they have to enjoy the discomfort. And as long as you get the concept of enjoying the discomfort, you will not, I'm going to use the word fail, because when people can't succeed, they call it as failure. I call it as feedback. And this feedback is I stopped midway because I didn't see success sooner. If you start enjoying the discomfort, then you are going to slowly make that discomfort into a comfort and then find the next discomfort. Yeah. So we are always, as human beings, between security and insecurity. And if we are secure, we feel happy. If we are insecure, we feel anxious. So I think the feedback or the mistake, as in your words, is not letting yourself be happy when you're uncomfortable.
Understood, sir. So, other than the systems, there's one thing which you say we need to get certified from third party, like maybe an ISO or NABH. Why do you feel that is essential?
Um, uh, i- for me, at this point of time, be it a Smile Circle accreditation or a NABH accreditation or a Care Quality Commission accreditation or ISOI, all these things are almost like a reward or a pat on the back or a authentication or a sign off to say, well done. Internally, I particularly feel that there are a lot of NABH practices. If I go into those practices, they might be off track. They have the certificate, but they are not really on track. Yeah. And in a sense, if you have the certificate, great. If you don't have the certificate, that's fine as well. As long as the systems are in place, people are experiencing that as team members, as dentists, as patients. If we can see the results, that is more important. So I'm going to actually change the word to say having the NABH accreditation is a social proof that we are compliant, and which is, I think, is necessary. But in the nicer sense, I feel in my heart, if all my systems are working, if my team is happy, if my patients are happy, if I'm happy, if everything is working on track, that's enough for me. But having a social proof obviously gives a testimonial to the practice. In the current eyes on online recommendations, these things become very, very essential. With COVID times, it has become even more important to say how safe you are as a healthcare business. So I'm going to say there are two sides of it, and being compliant is very important, and having a social proof is something which will drive faith and trust for you.
Understood, sir. Understood. So one before we end, one advice to the young dentists who are just graduated. What would you tell them?
Um, who have just graduated,
Yeah, or
advice to
young
young.
dentists.
Yep, I'm sure you are the expert in that field with what to do after BDS kind of stuff. But if I have to go back 25 years into my journey, if I have to start today, my career pathway is going to be this. When I'm in my internship phase, I finished my final year BDS, I'm doing my internship in the college, I'm going to at least find 5 or 6 dental practices within my vicinity of various demographics. Somebody who is mass practice, somebody who is class practice, somebody who is advanced practice, somebody who is really aesthetic and high end practice. And I'm just going to go and request for observation, which means Monday and Tuesday I will stand with Satish. Wednesday and Thursday I will go and stand in Amar's practice, and Friday and Saturday I'll stand with someone else. So I'll do my hard work in the internship phase where I'll build relationships with some senior dentists, some middle order dentists, and watch how they work and do anything in their practice, right from holding a suction to cleaning the tables, arranging paperwork, everything what they need as apprentice, and watch. And at a certain point in internship, they might just say, Manish, do this scaling for me. And that's my best opportunity, get some hands-on in private clinics. So that's my internship year. Then I come out, and out of these dentists where I build relationships, somebody might offer me a job at a very low price, as I hear, and I'll take that. And I will then work solidly on my portfolio to do general dentistry, a bit of cosmetic and advanced dentistry for year 1 and year 2. And in this year 1 and year 2 after internship, I will be focusing on shorter courses, endodontics, crown and bridge, composite dentistry, root canal treatments, etc., which is my base. At year 2, when I finish this, in these 2 years, I would also apply for CET and all the entrance exams for MDS, and then pick my niche and then go for MDS. So I'm now 24 and I'm going for another 3 years, which is getting me to 27. So by 28, my hands-on learning, my education as a base level with MDS is done. That's when, alongside, I'm going to get enrolled into some kind of a business understanding program like dental business masters, understand how the economics works, how the practice works, which is not taught in college. Now I'm ready to face either getting into my own dental practice, joining hands with somebody, working with somebody, or going for even super specialization. So if you're going into hospitals or craniofacial work, etc. So it depends where the career pathway goes. But
Understood.
you asked me a question about what is my advice, and I think the biggest one I can give is a little career pathway from 21 to 27. And I think youngsters are probably missing at this stage. Either they want to fly abroad immediately, or they want to go straight into MDS, and then they find the pit holes at the end because they became an oral surgeon, they came back into doing a general practice, they don't know how to do a root canal treatment, they don't know how to do a crown prep, and that's where they struggle. So I think this internship, 2 years, MDS, whatever they want to do, business understanding, education, and then getting into the field probably is a better pathway.
Understood. This is one advice I've seen a lot of successful people give. First, make your base strong and then only decide what niche you want to select. That's a very
Thank
good advice, sir.
thank you.
So, now that we have time, could you just please share a tiny bit of the Dent-Track software you were talking about?
Sure. Thanks, Satish. I'll just share my screen now
Sure,
and
sir.
let me know if you can see it.
Yes. Yes, sir. I can see it.
Okay,
Perfect.
great. Thank you. So basically, I'll quickly show you. It says Dent-Track. What it means is dental practice on track. And the two T's stand for tracking and training as well. So this portal will work for dental practices to actually keep on track. So at the moment, I've logged in as Manish Chitnis, which is on the top right of the screen. It says principal dentist and owner, but for demonstration purpose, I have tagged myself as a dental nurse. So on the left hand corner, you see a dashboard. It says jobs. Jobs means the jobs I'm contracted to do as a dental nurse. And tasks means my boss or my colleagues can put a task onto me. Yeah. So for this exercise, I'm a dental nurse and I walk into the practice on the Monday morning.
Yes, sir.
And today is the 13th of December. And it tells me, Manish, as a dental nurse, you need to do around 56 different things, as you can see on the screen. Yeah.
Yes,
So
sir.
there are 56 different things to be done. And as the day progresses, they don't need to be coming into the software again and again, but it's almost like a reminder. So what is the practice opening protocol? Have I opened, put the key in the key box? Have I switched on the air conditioning? Have I cleaned the entrance? So that's my first job. Material order requirements, forecast done and noted, set up treatment trays according to the appointment diary for the day, personal protective equipment protocol followed. Am I wearing the mask, the gloves, everything for the patient and myself, so on and so forth. Switching off the suction and compressor switch, ultrasonic cleaning validation, decontamination roof surface. So we have feed in best practice standards for a dental nurse, and some of it will apply and some of it will not apply to a
So
dental
one
nurse.
doubt, can I change this if I get this application? Can I change
You
the require
you
this?
can you can't change the words because that's at the back end with the company. So if you are a dental practice, then you get induction and training on these words. And in your regional language, obviously now if they don't know English, then it's a problem. But you can explain them. Switch off the lights means switch off the lights. Yeah. Sterilization validation logbook is a logbook. So if you're compliant with NABH or CQC or whatever, these words won't be alien. So helix test. Now this is for the UK dental nurse. So we have another portal for Indian dental nurses, and the terminologies change. But if you find a job which you think, Manish, actually this job as a dental nurse is not in your folder or your portfolio, then you pass that job to us and we will check it. If it's a universal thing for dentists or dental nurses in India, we will feed it from the back end. So all the dental practices can see that. So it's almost like
Understood.
a library of jobs, because most of the times dentists don't even know what jobs to give to dental nurses. And if they don't know what jobs to give, so we have come up with 56 jobs. And in the future, this 56 might become 60 or it might drop down to 50. So we are testing the system.
Understood, sir.
And the way it works is, say, I have come in and I've done my dental chair water bottle maintenance protocol for the day. So the dental chair water bottle disinfectant has been mixed. The water is correct. I've done my job. I go and I click update. So as soon as it's done, 55 jobs were seen here. And now it is two complete. There was one more test I did in the morning. So I've completed two jobs.
Understood.
So by the end of the day, if you see actually, oh dear, I forgot to do the ultrasonic cleaning validation, it's a reminder system as well. And once you do this 56 jobs every day and you're doing it anyways, it becomes a habit. But if you are forgetting, if you have a bad day, then this system is going to show you if you have forgotten anything. And then as a owner, on the backdrop, you can see how many nurses came in, what jobs they completed, how many jobs they did not complete. Now, if you remember, like, oh, I need to give my nurse this task to do, then you go into the task folder and you say test task. Say, for example, that's a task, and you say, I want it finished at 17:00 by 5 o'clock. I need it finished. It's only for today. And I'm assigning it to one of the team members, and I'll pick up Samantha. I want her to do it, and I submit. So it won't show on my dashboard, but it will automatically show on my team members' dashboard so they can see the task of what they need to do. So sometimes we communicate through WhatsApp, we communicate through phone, we send the email, we just tell them passing through the corridor to say, oh, Savita, don't forget, do this. And then Savita forgets, you forget. And when the incident happens, you say, oh, I told you in the corridor that, oh, sir, I forgot about it. But this system will not let anybody forget. It will hold them accountable to say, did I do it or did I not do it? And then you have a chance to help your team to get them more capable or training. So at the moment, say for example, PPE protocol followed, there will be a YouTube icon here as we progress with the system. So what is PPE protocol? What kind of personal protective equipment I need to wear? They can click here on the icon and the video starts playing. So it's a
Understood.
training tool as well.
So it's a really amazing software. I'm waiting for
Thank
the rollout in India.
Thank you. No, I'm quite confident that this is a gap and we all need some help. And then it obviously does some extra things like as soon as they log in, it is picking up what time they came in. As soon as they log out, you know when they went out. So attendance, late, coming in late, going home early, going home late, everything will be marked. If they want a holiday, they just go in here and they request a holiday, and then if they want to see any training videos, if they want to see any PDFs, Excel sheets, etc., that also sits in the resources. And as owners, you can run reports. So we are at the testing phase at the moment, but it's a good time to let the community know that we are coming up with this. So it's more of a accountability thing to feel responsible. And if there are 10 team members, the ownership doesn't come on me. It's all on the 10 to do their jobs because they are being paid to do the job at the end of the month. Yeah. And if they're saying,
Understood, sir.
yeah, if they're saying I've not done it, then the question is, should I be paying you? So it's in a way helping everyone to stay on track.
Understood, sir. Now
So
that we have seen your Dent-Track software, we know the importance of systems and we know that you teach these systems in details in your courses. I would want to know where dentists can enroll in these courses and how is the entire process.
sure. Dentalbusinessmasters.com is our website. First and foremost, I would say even before registering on courses, if you just come in, register yourself as a member. There's no charge for becoming a member of Dental Business Masters. It's on the website. You sign up and obviously you get entry into some resources which I've kept for you, like marketing templates, cash flow sheets, Excel sheets, ebooks, some training videos, frequently asked questions where I've answered the questions through videos. So there is a lot of material in there. Then there is Dental Business Masters Facebook group where there is a treasure worth 7 years between me, Chris Barrow, Ashley Latter, Laura Horton. We have done lots of lives, resources, podcast, blogs. So there is lots in there. And obviously, after that, if you feel energized, more than registering on the course, come into a strategy session with me for 30 minutes. So I do complimentary one session with anybody who's wanting to know more. I work with you as a one-to-one to give you solution for one challenge in those 30 minutes and give you a direct training one-to-one to see if you like it. And once you know that, then obviously you come on the program, and the program runs for 6 months as the starting. And if you're energized enough to do more with me, then you can do a 1 year program. And if you really want to go to the top level, then you do a 2 year program. The pricing starts at 90,000 rupees for the not base program, but the elite program for 6 months. And then it goes up to 2,40,000 rupees, but that includes lots of bonuses, softwares, and one-to-one coaching. So that's the pricing. That's the tenure between 6 months to 2 years, and information is through a brochure. So when you go on the website, register yourself as a member, send us a message, and then arrange a one-to-one with me. That's the way to go ahead.
We will be mentioning the website on our Instagram page as well. So if you forgot about it, do not worry. You can go and check it out there.
Thank you. Thank you, Satish.
Thank you, sir. It was a really amazing interview. I personally got to learn a lot of why we need systems, what are the various systems we can apply. If we have problems, how do you overcome them? Thank you, sir, for taking your time and coming here.
Thank you for reaching out and glad to share the experience. Thanks a lot. All the best to you.
Thank you, sir.
Thank you.